thank you everybody for joining Healthcare in Hong Kong. I'm Levi Shapiro, the founder of mHealth Israel. We're going to hear from 5 extremely prominent leading figures in the Hong Kong healthcare community. Each one will present for 10 minutes. Then we will have a moderated discussion led by Gil Bashe. We're very grateful that you've joined us. This will be recorded and shared with the mHealth Israel LinkedIn community. First, we'll hear from Dr. Hong FUNG, who leads the most prominent private provider in Hong Kong, academic medical institution. Dr. Sining Zhao, medical director at Bupa. Rupert from the Hong Kong Medical and Healthcare Device Industry Association. Dr. Yimien Ko from AXA. And Andrew Wong from Prudential Asia. Again, each presentation will be 10 minutes long. You can put questions into the chat. We will try to address those. You can also write me afterwards and we can try to share that. All of these presentations will be shared with the community on the mHealth Israel LinkedIn group. We're really excited about such a prominent group. I'd like to thank the Hong Kong consulate, the Israeli Hong Kong consulate, who helped connect us with Dr. Fung. They're an ongoing resource, and hopefully the desired outcome of this discussion is that Israeli companies will consider more activity with some of Hong Kong's leading players in healthcare and technology. So with that, I would like to transition to our first speaker, Professor Hong Fung. The floor is yours. You are a co-host and you can share your presentation and begin when ready.
Okay, thank you very much. Can you all see the PowerPoint?
Yes. Perfect.
Okay, great. Okay, so I'll use the 10 minutes to firstly briefly go through the Hong Kong health system, and then I'll talk a little bit, focusing a little bit on the sort of digital development within both in the public sector and private sector in Hong Kong. So this first slide shows our latest results figure on the life expectancy in Hong Kong. We are the jurisdiction with the longest life expectancy now, longest life expectancy in the world. So the female is 88.1 years and the male is 82.2 years. And that longevity actually gives us problems, especially in the public sector. Yeah? Now, this is the guiding principle of Hong Kong's health system. No one should be deprived of adequate health care because of lack of means. But of course, in today's world, adequate means a lot. You know, it means a lot of advanced treatment, target therapy for oncology treatment, or even cell therapy. So adequate actually it does not constrain, does not define the level of resources that's required. But on the whole, we are spending around slightly less than 6% of our GDP in healthcare. This is from publication from our domestic health account. And as you could see, we are actually at par with a lot of countries and jurisdictions within this region. And 6% healthcare GDP on healthcare expenditure is actually sort of reasonable compared to like OECD countries. But in this region, the lowest is Singapore, it's only 4.something%. We spend around half of our expenditure on public and around half on private. But the burden is on the public side. One of our previous secretary for health, who's actually supposed to be Minister of Health, used to describe us as a dual-track system, where there's a public sector and a private sector. The public sector is actually led by a statutory organization called the Hospital Authority, which is responsible for managing all the public hospitals in Hong Kong. And at the present moment, there are around 44 of them with around 28,000 beds. And they take up 90% of the inpatient bed base, whereas the private hospital sector only around 13 hospitals, but taking up only 10% of the bed base. So the burden, the heavy burden, is in the public hospitals. whereas on the outpatient side, private sector actually take up 70% and public only 30%. So primary care is actually mainly in the hand of the private. Yes? So this is what we call a dual track system. And for a long time, this sort of dual track system got problem, especially in terms of the high demand, virtually free at the point of delivery, public sector. The queue is long. People have to wait a long time for non-urgent outpatient consultations or operations. Waiting time could be as long as 2 years. So very long. But on the private side, it's actually very expensive, even for a lot of the middle class people. So we are actually trapped in a situation in which, although the system seems to be kind of universally accessible, but on the hand, there are a lot of bottlenecks and barriers in terms of access of care. So one of our previous secretaries defined the priority in terms of public health care. So this is because we really need to communicate to the public, what our priorities are and where should they focus. And these include 4 areas: acute and emergency care, taking care of the low income and underprivileged groups, and also taking care of illnesses that entail high costs, advanced technology, and multidisciplinary team, in which usually it's actually more difficult to get in the private sector. And of course, on the training of healthcare professionals as well. And because of this dual track and dichotomy situation in the Hong Kong health system, which has been lasted for decades, so in the past decade or so, the Hong Kong government has tried to introduce various measures to strengthen the health system through various means, both on the financing side and also the provider side, as well as in the interface. So on the financing side, for example, an elderly health voucher scheme is actually provided to fund primary care level services provided by private practitioners. And the elderly citizens can actually make use of the money to purchase private health care. And then they've also developed a lot of public-private partnership schemes to address bottlenecks, long queues in the public sector. And I think the most prominent PPP scheme is actually in the areas primary care as well, where public sector patients can be referred to private practitioner to actually take on the primary care, especially like the management of their chronic illnesses. I think one most important thing is the electronic health record sharing system, which I'll go into a little bit detail later on, which allow the sharing of electronic health records throughout the whole territories, so that every citizen in Hong Kong, whether you actually to make sure that whether the patient is seen in the public sector and private sector, the health records is always accessible. And I think for the public sector in particular, the electronic patient record is actually accessible anytime, anywhere within the public system. And then 2 years ago, the government also started to impose, to reform the regulatory framework, especially in the controlling the quality of the private healthcare facilities. And this is not only in relation to the clinical care quality, but also in relation to price transparency as well. And then the introduction of a voluntary health insurance scheme, which is basically a regulation, on private insurance and voluntary insurance. And as we have quite a number of colleagues coming from the insurance industry in this event, so I'm sure this will be further explained later on. And then also, from my current role as the CEO of the CUHK Medical Center, a new type of private hospitals under special service needs, in which we have to deliver something special, especially in the offering patients with package price services, bundle services, instead of a fee for service type of payment arrangements that actually will lead to cost escalation. So these 6 measures became the pillars for strengthening the health systems in Hong Kong, and many of these initiatives are still going on at the present moment, still ongoing. So it will be an ongoing process to evaluate, their results. But since this forum, I understand there's a lot of technology people joining as well. So I'll focus a little bit on the digital health development in Hong Kong. Now, this is the development in the hospital authority, the public sector, and we started off back in the 1990s, in which there's green field, nothing there. And we started to, and then when we look around in the market, there's not much available as well. So we started to embark on a journey of developing our own, what we call clinical management system, and also electronic patient record. So much so that at the present moment, you can say that it's actually one of the leading sort of electronic patient record in the world. And then it's actually available in all the public hospitals, as I said, on a 24/7 basis, and anywhere, any hospital. Citizens in Hong Kong can ensure that their records is available when they require access of care. In 2010, the government also started to develop, to expand the electronic health record system within the public sector to form a platform that allow the sharing of medical record with private healthcare provider, and that becomes the EHRSS, which can be seen here, or the acronym for Electronic Health Record Sharing System, that allows sharing of medical records and with the private providers. And initially, it is one way from public to private, and later on, now the stage 2 is actually two sort of both ways. That means it allows private sector to share with the public sector as well. And then, there's actually a smart development in the past 2 years, like the development of in the hospital authority and apps for patients called HA Go, and they started their smart hospital development as well. And this is the strategy HA adopted in the smart hospital development. It's a co-delivery model that involves the engagement of the frontline workers from the local levels. They call it cluster, which is actually a geographically based cluster of hospitals grouping together to provide services. And then they take on a lot of allowing the local level, at the local level, to build solutions, to buy here local. It says local solutions, but these local solutions, of course, in the Hong Kong setting, it could actually be something totally local, but it could entail overseas partnership as well. A lot of innovation, a lot of startup actually help together build, possible solutions. And then all these innovations will group together, and then we have funding from the government, which is called the IT block funding from the government that will help the products, and then eventually channel to the hospitals to provide hospital level rollout. So this is actually the co-delivery model of HA. And so it has developed a vision for a total digital health ecosystem that make of interconnected systems like mobile applications like HA Go, patient home monitoring, tele-rehabilitation, to a lot of things that happen in the hospital, like robots, hospital support systems, command center, and all that. And I think the most remarkable thing is because HA has been developing this huge, big electronic patient record system and have a lot of data generated. So they're actually using AI to develop artificial intelligence to allow sort of risk categorization, risk stratification of patients, especially for the chronically ill patients, and then make precise sort of treatment decisions for individual patients on a mass scale. So this is actually the sort of most remarkable sort of development currently happening in HA. On the private side, like in my hospital, we are also developing a smart hospital strategy with 3 components: smart medicine with a fully digitized medical record system. On top is, of course, another layer of deep learning, artificial intelligence as well. And then the use of mobile applications to support the real-time experiences of patients to support smart care, and also development of IoTs and IoT platform to allow the smart management of a lot of hospital services. It is actually built on an open integrated platform, allowing like the interchange of data, interoperability, in standardized communication format, adoption of things like FHIR standards in terms of linking all the soft devices with all the core hospital information system. Yeah. So applications of IoT, development of IoT platform integrated with hospital information system with 5G connectivity. So this is actually what we're building at the present moment. A lot of the solutions, again, is actually sort of co-developed with a lot of local vendor, supplier, startup, and all that, and many of these got international collaborations as well. So this is integrated everything into the sort of integrated hospital information system, and so the digital component make up a large part in terms of the transformation of the Hong Kong health system at the present moment, and also I could foresee in the next coming decade, and is actually moving quite fast, especially on the provider side. So this is my short presentation, and I welcome subsequent discussion and also questions later on.
Thank you, Dr. Fung. That was really helpful, very descriptive also for an audience of with technical backgrounds. And we're very grateful that you were able to share your expertise. I do want to now transition to Dr. Si-Ning Zhao. We're very fortunate. Dr. Zhao came to us via an introduction from Gilad Reshef, who is joining the group, and I recommend Israelis interested in understanding Hong Kong, reach out to Gilad. And so, Dr. Zhao, if you can take over, I will pull up your presentation, and I can be your assistant and move along the slides at your request.
Right. Okay, thank you so much, Levy. And yeah, it's a great honor to be amongst quite distinguished panel, and also to be able to speak to a great group of people about Hong Kong. And so my presentation will sort of focus on, I'll wait for Levy for you to bring up the slides.
Do you see the slide on your screen? That is your slides. Oh, I'm sorry. So while you're doing that, if you can just talk a bit, I apologize. I'll pull up Dr. Zhao's presentation, okay?
Sure.
Here we go. All set. Good.
Fantastic. Thank you so much, Levy. Okay, so so changing tack a little bit, I guess. My name's Si-Ning. I'm the medical director for Bupa in Hong Kong, and so I'll be sort of talking about promoting sustainable healthcare in Hong Kong from an insurance point of view. So if we go to the next slide, Levy. I think Professor Fung sort of went over some of this at the beginning of his talk, but in Hong Kong, we do have some major challenges that we're facing. So we do have an aging and growing population. They forecast that Hong Kong will have an elderly growth of quite a significant portion of our demographics will be over the age of 65 by the year 2040, and they think almost 1 in 3 will be above the age of 65 in the year 2040. So that is a good third of the population. We're also facing some challenges in the manpower infrastructure space. Our healthcare system is challenged by a severe shortage of doctors and nurses. And the per capita ratio of Hong Kong sort of lags behind many of the more advanced economies. So Hong Kong has approximately 2 doctors per 1,000 population. Singapore rests at 2.5, which is similar with Japan. The United States is just a bit better at 2.6. The UK is 3, and in Australia, it's 3.8. So it's almost half of that in comparison to Australia. There is also the challenge of the rising cost of healthcare. We're facing medical inflation, whereby a lot of the new sort of technologies and new services tend to be quite expensive, and we're seeing a split in people being able to access some of the newer technologies and also newer treatments. And also, lastly, there is a slight imbalance of public and private healthcare utilisation. As Professor Wong also alluded to, the majority of Hong Kong population would rely on the hospital authority safety net, which is our public healthcare system, whereas the small percentage of the Hong Kong population is able to access healthcare through the private means, but that is and can be challenging to access from an economic standpoint. Currently, public hospitals provide around 80 to 90% of all inpatient bed stays, and staff in public hospitals only count to around 50% of active doctors in Hong Kong. So there is a bit of a scaling issue with that. Now, if we look at the right-hand side of that slide, I've pulled up some of our data from our claims. I've used 2019 data because I think 2020 data is a little skewed given the world went into a pandemic. And so hopefully this will probably reflect a bit more of what is a normal year. So clinical, we do see quite a lot of obviously the common cold and also skin issues, and that's a lot to do with Hong Kong's environment. For hospital claims, a lot is to do with gastritis and gastroenteritis and colon issues, as well as eye issues. And that obviously leads into our procedure claims where colonoscopy, endoscopies, and also breast procedures are actually coming up to become quite prominent in our claims. So, taking a snapshot of our challenges and also what we're seeing coming through our actual members and also what their needs are through their diagnosis and claims. Next slide, please, Letty. We at Bupa really want to move our membership. And we really think that through our data, we want to provide very customer-centric healthcare, enabling our customers really to access healthcare through digital means, and also for us to be informed digitally as well, in order to provide the best type of insurance and healthcare to our member base and to the people of Hong Kong, and to help them live longer, healthier, happier lives, especially in terms of sustainability, to make a better world as well. There's some ways that we are doing this. Next slide, please, Letty, is to drive sustainability in healthcare. One thing, as you saw from the claims data, we have a lot of sort of endoscopy and colonoscopy cases. So that's sort of investigations to do with your gastric tract, your stomach, and your large bowels. We're finding that a lot of our membership or people in Hong Kong, they tend to go inpatient into hospitals. That tends to utilize a bed unnecessarily, whereby a lot of these investigations around the world, such as UK and Australia, in the US, these will be done as outpatient day case procedures. You just go into clinic, get it done, you can go home. You do not need to sort of use a bed or the resources that could be directed and towards sort of more serious cases. And so what we set up is sort of a direct access to a network of day case centres of different specialties, including endoscopy, but also we now cover eye, skin as well, and also some other modalities of specialties, and to ensure that we are able to divert in a way, but also improve access for our membership into these daycare centres, to educate them that they don't need to automatically go into a hospital, and it saves them time, it saves medical costs, it really relieves the burdens on the hospitals, and also because it is a more efficient way of treating them, it is hopefully more sustainable in the long term. What we also understand is, from an ageing healthcare population, we have the burden of chronic disease. So in Hong Kong, very commonly you'll note that they talk about 3 highs, which is high blood pressure, high blood sugar, and high cholesterol. In doing some of the research that we have done through our data, we realize that a lot of times there isn't that great primary healthcare management that allows integrated care of a lot of chronic care management. People tend to see doctors on and off only when they feel like it, but the actual integrated care, the multidisciplinary care model is not really there. for a lot of these chronic diseases. And so what we're trying to create is a care pathway model whereby people in our books, our members with these diseases are able to get that end-to-end integrated care, one-stop shop almost, and also they're able to access that quite relatively easy and without needing to go to all these different people to find out how to manage the one disease or the multitude of diseases. So we want to steer patients towards the right pathway with that integrated end-to-end care. We want to try to see if unnecessary surgery can be avoided, because a lot of times if they do automatically go to a surgeon or go to some other specialties, they might not be getting sort of that primary care that they should be having at the first instance. Hopefully this will allow them really to be able to monitor and manage their chronic health better, and also have tailored treatments, and not just from a pure medical standpoint, a clinical input, but also from a wellness standpoint as well, because we think that it's very important that the whole person holistically gets looked at. And so we want to integrate all of these different aspects of care into that end-to-end journey, as I said, but also through and enhanced through digital healthcare tools. So next slide, please, Debbie. One of the things that we really have sort of launched this year is the video consultation method, which is to try and enhance people to access the care conveniently, easily, and especially during this pandemic, when people can't leave their homes or they can't access healthcare physically, they can do that through video consultation. And so we provide through our sister healthcare company consultations. We allow them to have electronic payment. They get email receipts. They're also able to get medical certificates, whatever they need, through email, deliver the medication to their door or to their office, and also they will have a free follow-up consultation at a physical location if they need it. And so hopefully that will allow more people access easily and more conveniently to medical care. The other thing that I note, next slide, Levy, is about that digital interface, that we want to integrate care, not just from the clinical point of view, not just seeing a doctor or a surgeon, but also to look at their complete health. And so Bupa's launched Bupa for Life. It's a digital app that connects health and wellness together. So through this, people can download the app, have an online health assessment. They have tailored monthly challenges, a daily activity tracker, targeted wellness events, calendars, and health rewards. So firstly, they will get analysed. They will be given specific action plans to try and achieve certain goals. They'll be assisted through that, through some tailor-made articles, and also inputs through our we get people who are sort of leading in the field to also give to write articles and give support, and then they get rewarded. So it's they get rewarded for staying healthy, and in a way we want to motivate people to stay healthy, and also they can do this with their friends and with their family, so they can join groups and form support networks within the app. And through this digital enabler, we want to be able to support our members through the fact that we want to give them that physical clinical access to healthcare, but really also show them that staying healthy and preventing disease is also a critical part of the healthcare journey. Next slide, Libby. And so I think that sort of concludes my portion of the presentation, and just really appreciate your opportunity to speak today. Thank you very much, Libby.
That was terrific. Thank you so much, Dr. Zhao. Dr. Zhao will be coming and going. She is on a very rigid breastfeeding schedule, and we're grateful for her excellent presentation. And let's move along. Rupert, are you going to make your own presentation, or should I share it?
Yes, please let me share my screen.
Good.
enable me, please?
Yes. So Rupert, while I'm doing that, would you mind just making a quick introduction? I'm looking for...
Yep, I'm Rupert Mok from the Hong Kong Medical and Healthcare Device Industry Associations. Myself is a biomedical engineer by training. My specialty is in the intervention cardiology on pacemakers, defibrillators, and coronary interventions. At the moment, I'm also a independent non-executive director of Vincent Medical, a listed company in Hong Kong. And I'm also a panel member of the Innovation and Technology Bureau, the FUNG Research Project Assessment Panel under the biotech. So I encounter many projects that we will be funding. Actually, Hong Kong government are quite generous recent years to provide funding to with R&D from universities and so on. So it's a very so they can we can do a bit more R&D as well as pushing that into the market for newer technologies. So Levi, you not I cannot share my screen yet.
Right, I've just made you a co-host, and if you have a problem, just let me know, and I can always share. And Rupert came to us via an introduction from Fred Tung at J&J, who's an SVP there, so we're grateful for that introduction.
Can you see my screen?
We do. If you could enlarge your screen, that would be even easier to see. Perfect. Now it's perfect.
Okay. All right. Let me carry on. Back in 2017, the World Bank can make a life expectancy versus health expenditure. If you look at this, red line is more like Asia. Hong Kong is the healthcare spending is about 3,000 per capita here. And Dr. Fung already mentioned we're actually the highest life expectancy now in the world. And if you look at some other countries, especially United States, they spend a lot of money, but their life expectancy are not quite low compared to other countries. So, however, it does cause worse aging problems. By 2040, we have 32% of people more than 65 years old. So we expect increase in chronic disease, DM, high blood tensions, respiratory, etc. Hong Kong cancer prevalence rate is about 2%. Hong Kong healthcare system have both public and private. So the Department of Health have basically have all different types of clinics and health center to manage the public health. And the public hospital authority are managing all the public hospitals, while the private hospitals and clinics and Chinese practitioner for healthcare. So the hospital authority basically divided Hong Kong in 7 clusters, geographically as well as population. So they make sure every cluster have enough hospital to cover the population, while the private hospitals are mainly located in the more populated area. And we have 43 public hospitals, and one of them, a recent one, is the Hong Kong Children's Hospitals. It has the first robotic delivery system, and Kai Tak Hospital to be complete in 25. It will be the biggest acute or emergency hospital. And the private Chinese University Hong Kong Medical Center operated recently, of course, managed by our Dr. Fung Hong. And the Hong Kong Hospital Authority also doing a lot of extension and rebuilding of their facility like Queen Mary, United Christian, and Kong Wah hospitals. Hong Kong have 33,000 beds, and which account for about 5 beds per 1,000 citizens. Similar ratio for UK, US, Singapore. And we have medical professional doctors about 1 to 500, dentists 1 to 3,000, nurses 1 to 140. And we also have non-government organization services which look after the have daycare centers and clinics. We have about almost 1,000 private and subsidized elderly homes. A couple of years ago, the government rolled out a district health center, which basically is a trial. They looking starting from primary healthcare services. With that, they want to enhance the public awareness of disease prevention, public capability in self-management of health, and then support for residents with chronic health condition and their caregivers. So this is an ongoing evaluation and will extend to other part of the Hong Kong. And for some financials, 6.2% of GDP, about 23 billion US are used in as a healthcare expenditure in 2019. That add up to be about 3,000 per capita. The health expenditure average growth rate is about 5.6%, which is much faster than 3.7% growth in GDP. And Hong Kong public hospital fees are generally low. And however, Hong Kong does not have a public medical insurance. Health expenses coverage a lot of by employers' insurance funds or private paid medical insurance or co-payments. However, Hong Kong have medical support by the government, like the disability allowance for disabled to cover their home medical fee. And also we have a comprehensive social security assistance scheme. For example, a patient need to implant a pacemaker, but he cannot afford it. After evaluation, the government will pay for the pacemaker. There are other charity funding to support it. So this is a plan for public charges in the hospitals. These are in Hong Kong dollars, so pretty cheap. However, in public hospital, a bowel surgery will cost 20 to 30K per surgery. The voluntary health insurance scheme was rolled out a couple of years ago. And starting last year, we have 67 certified insurance plans and 257 products for us to choose, offered by 29 insurance companies. The government targets about 1 million Hong Kong people will purchase these certified plans in the first 2 years, and they believe they will achieve the targets. So Hong Kong medical devices, doesn't matter, it's diagnostic, consumables, dental, orthopedics, they are all projecting growth in future years. The Hong Kong CE, Chief Executive of Hong Kong's, in her public policy address, she committed to spend 200 billion Hong Kong dollars in the coming 10 years to create more public beds, vaccinations, free vaccinations, psychiatric drugs, and many other services, healthcare services for Hong Kong people. For the future development, one of the important part is the Guangdong, Hong Kong, Macau, Greater Bay Area development. It is a national strategy from the central government, so it's not only a local initiative, which include 11 cities at the Pearl River Delta Bay area, which including Hong Kong, Macau, and the adjacent 9 cities with the population of 71 million. So Greater Bay Area is in Guangdong province, and last year's GDP of Guangdong is 1.6 trillion. It's the #1 provinces in the whole China. And if you compare the world, it's actually ranked between number 9 and 10. It's comparable to as big as Canada. So that's the Greater Bay Area market we are looking at. So what about it? It is the work plan for regulatory innovation and development of pharmaceutical and medical device in the Greater Bay Area. It rolled out end of last year that the Hong Kong registered drugs and medical devices are allowed in designated Hong Kong healthcare institutions in the Greater Bay Area. And it will, the trial will complete by July this year. And once after evaluation, it will roll out to the Greater Bay Area hospitals. So there are a couple cases already approved. Magnetically controlled growing rods to correct serious spinal deformities in children, such as EOS. The first surgery case was carried out in the Hong Kong University Shenzhen Hospital last month. And the first drug item is the NTD, immunoglobulin injection, used to prevent hemolysis of newborns for a RHD negative mother. It was done in April this year. And more products are going to, and drugs are going to be approved. So the Hong Kong Medical Healthcare and Devices Industry Association, we have 183 members, mainly are corporate members, some from overseas and some from China, mainland China. Majority are manufacturers, 45%, and we also have R&D, distributor, importer, exporter as our members. And our members altogether provide a continuous value chain from basic research to prototype development, clinical trials, regulatory approval, and all the way to production and marketing. So that's our role in the medical healthcare in Hong Kong as well as China. So thank you. I'm looking forward to our discussion later.
Thank you so much, Rupert. That was very helpful. And for anyone in the audience on the device side, I think Rupert and his industry association can be an excellent intermediary in terms of not only Hong Kong, but as he mentioned, the Guangzhou province and greater Pearl Delta region. So thank you so much. That was very helpful. We're going now to transition to Emian Ko, Dr. Ko. I can move along your presentation, or you can lead the presentation, whichever you prefer. You may, there, good.
Can you hear me?
Yes.
Okay, yeah, please do. If you could move the presentation, that's great.
Okay, sure. And while I'm doing that, maybe you could just introduce yourself.
Okay, so my name is Emian. I'm the Chief Partnership Officer for AXA in Asia. I started this role back in February. And prior to that, for the last over 3 years, I managed the health business in Hong Kong. Hong Kong is a great place to be, very vibrant, and certainly a lot of activities in terms of health development, not least since the launch of the voluntary health insurance scheme by the government 2 years ago, which you heard Rupert talked about. I think it has provided more avenues, and also we have leading lights like Professor Fong Hong, who introduced smart hospitals and really electronic health records. So I think that there's so many in the whole ecosystem that we makes the whole health community very vibrant. My talk is going to be about digital health. Actually, we didn't plan it, but I think that it flows on very nicely from all the context about the Hong Kong health system that you have heard from previous speakers. But what I will focus on is about digital health. I'm passionate about digital health, partly also because of my current role in partnership, because I do believe that, especially since the pandemic, online, offline, an integrated approach is essential to provide holistic healthcare. Next slide, please. In Asia, as in the world, health is one of the key strategic pillars for AXA Group. And so certainly in Asia, we as a group wants to develop more health business and do more health, but do it properly, do it really sustainably, and providing patient-centered care that is holistic, but also very empowering. Because we want to make it sustainable. And earlier on, we heard from Dr. Zhao about cost and how we ensure that insurance itself becomes sustainable. Next slide, please. So our answer to the holistic healthcare digitally is called Emma. And Emma is, you can see her there, a lady actually went through different permutations. I think she looks good. She's our holistic payer to partner gateway into an ecosystem. And by having Emma, which is a digital app, you can do everything in your hand from beginning to the end. And later on, we will take you on the journey and you can see what happens when you use Emma. Next slide, please. An overview of Emma is the gateway to the ecosystem. Sometimes when you go into a digital app, you get the usual services like payment or checking your invoices and your policy and so on. However, we believe that we want to get customers to actually use Emma. So we put a lot of services into Emma, most of which are free, so that we hope that we will really engage customers on their healthcare journey. And one of the things that I'm really passionate about is, for example, symptom checker, because not only is empowering, it gives customers, patients, information about their condition, also helps them to decide whether they should be consulting a doctor or what they can do to self-care, really giving the control back to patients, and then the health post, the insurer as the support mechanism to enable a healthcare journey when that is needed. And of course, being digital, it is available 24/7, so people can always check what they are in their hand, what they are entitled to, but also access the service whenever they wish. And the services includes everything from step count, we talk about healthier, longer lives, and where we support it with product design that actually reinforce the healthier lives. So for example, we have a step count that enables people, if you walk, say 10,000 steps 5 days a week, you even get your weekend off, it actually gives you like 20% of your premium. So we really believe in making it real for patients and for customers. And we also have, of course, mental health programs and all sorts of programs, including access, of course, to teleconsultation and so on. So all the, I would say, state-of-the-art digital tools are in Emma, and more will be joining the ecosystem as we develop more. Next slide, please. I mentioned about Emma in Hong Kong. That's where Emma was first started. Well, actually, it's our plan that Emma will go live across all of the markets in Asia. It will then become the gateway to ecosystem in the whole of Asia. And already, as you can see, we have Emma in different countries, and more markets will also introduce Emma. And what we try to do is for the Emma to be localized. So you have a cartoonist Emma in Japan, which actually I quite like. I thought that's very nice. And they are very localized to how the local people access healthcare. So they look the same, but quite different too. Next slide, please. Okay, so this is the big picture of Emma, and it's now implemented across the market. Next slide, please. This is my last slide, because in here in one page, you can see the sort of a holistic picture of all of our payer to partner strategy. So you can see the core, which was started a few years ago, where people can access all of their services, all from finding your doctor on the list, to your hospitals, to making a payment. Just take a photo and scan and send it off. So no more putting in envelopes, and then you can check your policy coverage at any time, and so on. So those are the core services, but more and more we are providing pay and to partner services. So everything from symptom checker and mental health, as I said, and so on. Very comprehensive. Otherwise I'll be reading through the list. So what we hope to do in future is that customers will come to Emma as their first port of call. So whenever they think I need some help for health, I will come to Emma, whether for wellness or sickness. And then we can help them to navigate through Emma. We have a chatbot, of course, but we also have a real human behind, and if necessary, care coordination as well. So I think actually that is my last slide, isn't it, Levy? So,
yes.
Okay.
Fantastic, really exciting and innovative. So thank you for sharing that example. We have one more discussion from Prudential Asia, Andrew Wong. So Andrew, I'm going to pull up your slide. Can you introduce yourself while we're waiting? Andrew, are you there?
Sorry, it's the usual mistake, talking while I'm on mute. So my name is Andrew Wong. I'm the Chief Health Officer with the Prudential Corporation Asia, based in Hong Kong. So I look after the health initiative in Asia and Africa. So it's an honor to speak at this forum together with other distinguished guests as well. So a lot of the speakers already talked about the healthcare system and challenges in Hong Kong. And also we learned from my colleague from AXA about Emma as well. So I'm going to do something similar, but a little bit repetitive, but hopefully that also gives you some insight and also a bit of flavor of what's going on in Hong Kong and also in Asia as well. So you think the slide is going to be up, Levy? Or I can keep talking?
For some reason, I'm not sure where I'm, but we're getting there. I'll pull that up in a second. If you don't mind,
no
continue.
No worries.
Thank you.
So what I'm going to do today or this afternoon is to share with you the healthcare challenges we face not only in Hong Kong, but in Asia, and how Pulse by Prudential, the health ecosystem built by us, can address some of these challenges. Before I go into details, let me spend a couple of minutes with you to talk about who are we. Prudential Plc is a leading pan-Asia and Africa life and health insurer and asset manager. We have roughly about 17 million customers in these two regions. And we operate in 13 markets in Asia and 8 markets in Africa. We do have a multi-distribution approach with 600,000 agents, both in Asia and Africa, and 20,000 bank branches selling our policies. And then, of course, lately we do have Pulse, which is our digital platform. And we also distribute insurance products while that digital platform as well. So the main purpose of Prudential, even though you can't see the slide now, but the main purpose of Prudential is to help people get the most out of life by offering affordable and accessible healthcare and protect people's wealth and grow their assets. And we also empower our customers to save for their goals.
I'm sorry to interrupt. Can you see the slides? Is everybody seeing the slides that I'm sharing?
I can see the setting or the file names.
The file browser we see.
Yes, and why don't we wait just a second? This is such an important conversation, I think, not just about Hong Kong health, but world health. And so, Andrew, if you don't mind just sharing some additional background for a moment while Levy pulls up your deck, that would be appreciated. First of all, while Levy's doing that, I also want to acknowledge all of our panelists and speakers. This presentation is being recorded. It will be shared. I am also, as a supporter of the program, a friend of the program, taking screenshots. There we go. And I'll be sharing the screenshots out on Twitter. But again, my congratulations and thank you to our presenters. It's extraordinary.
Thanks very much.
Thank you.
Thank you. So, Levy, I think we can probably move to the next slide. So that's basically what I talked about, Prudential PLC, who are we and what we're here for, and where do we operate. So I'm not going to repeat myself on that, and we can move to the next slide, please. So the next slide, I'm going to talk about the healthcare opportunities and challenges in Asia. Our goal is to enable our customers to live healthier and wealthier, but healthcare is of a significant concern to everyone in the regions, both in Asia and Africa, because of the following factors. A number of the speakers did touch on this before. I try to summarize it in the Prudential way. So firstly, there's a rise of middle class in the region because of the wealth creation in Asia. Generally, residents here, they are getting wealthier. And then as a result, they want to have choices, the choice of doctor, the time they want to be admitted in a hospital for elective surgeries. And they also want to have access to better services as well. And the lack of exercise and also unhealthy diet also cause significant healthcare issues. And secondly, the population in Asia is aging rapidly. So I think Dr. Fong mentioned about the average life expectancy in Hong Kong is about 85, which is the highest in the world. And the same applies to other jurisdictions as well. So the longer the life expectancy, the more demand for healthcare, as we all know that older people, they're more vulnerable to cancer, stroke, and worse types of chronic illnesses. And then the third element, which drives the demand of healthcare, is to do with medical inflation. We've done a number of surveys, not only in the region, but all over the world. Is that typically medical inflation is 2 or 3 times higher than that of the regular consumer price index due to a number of reasons. It's to do with shortage of healthcare professionals, whether they are doctors, nurses, or physios, and also medical advancement. So a number of us talk about the advancement technology, which can be, in the past, a lot of the surgeries needed to be done at hospitals now that can be done at day surgery centers. And also a lot of the chemotherapy drugs, they are more effective and has less side effect. But very often, the new treatments, they are more expensive than the conventional ones. And in a lot of the Asian markets, countries like the Philippines, Vietnam, Thailand, and Indonesia, the population is not that evenly distributed, and the access to quality healthcare can be challenging in the rural areas of these countries. And then I can give you some specific examples about the healthcare challenges we face in Asia. In the Philippines, for example, 1/3 of the Filipinos might die prematurely from non-communicable diseases due to alcohol, tobacco, diet, and physical inactivity. And in Malaysia, which may be a surprise to a lot of you, is the most obese, has the most obese population in Southeast Asia. And a lot of them, of course, they suffer from NCD and diabetic as a result. And then in Hong Kong, there's a massive shortage of healthcare professionals, doctors and nurses. So these are the issues we're facing both in Hong Kong and Asia. Next slide, please. So Dr. Fong already talked quite a lot about the public healthcare system, and I think same as from my other colleague, Rupert, as well. So I'm not going to repeat myself, but I think the key point about this slide is I want to draw your attention is about the healthcare fundings. So not only in Hong Kong, but it's quite common in most of the Southeast Asia countries. The funding of healthcare, majority of them is coming from the government. And also a number of the charitable organizations, whether they're churches or other form of charitable organizations, and private health insurance is also another major source of funding. And then, of course, the last and the less desirable one is the out-of-pocket from the patients. In Hong Kong lately, the government had already introduced the so-called WHI as the voluntary health insurance scheme. And I think Robert did touch on that before. So the aim is for the government to set some minimum coverage for the private medical insurance coverage. It's not a mandatory one, it's voluntary, but it's tax deductible to give an incentive for people to buy. And also it guarantees a lifetime renewal as well. So by launching that scheme, I think the government tried to shift some of the demand in the public sector to the private. And I think that's the main purpose of doing that. Next slide, please. So for Prudential as an organization, we have a clear understanding of the healthcare challenges in the region, and there's a significant health and wellness gap in both Asia and Africa based on the various studies. So our vision is to protect the health and wealth of our customers through the use of technology, through the use of artificial intelligence, so that they can have access to affordable and quality healthcare. And that's the reason why we built a health ecosystem called Pulse. Prudential used to be a traditional life and health insurer, and we have changed ourselves. We changed ourselves from a health payer to a health manager. Next slide, please. We took the prevent, postpone, and protect concept against illnesses to the market. We transform ourselves from the delivery of care from sick care to wellness. And we partner with quite a number of healthcare players in the region to provide comprehensive virtual and physical health services through the use of technology. There are 5 areas of value-added services we introduce to our customers through Pulse, which is the Prudential's health ecosystem. The first one is the lifestyle and wellness programs. We help our customers to keep track of their daily activities, sleeping pattern and dietary pattern as well, so as to enable to provide coaching to encourage our customers and also the Pulse users to improve their health. The second area of service we provide is risk factor identifications. So our Pulse users can monitor their current health status and also future risk factors through the digital health assessment online and also DNA testing. The third category of service we provide is to do with disease management and recovery. So if our users, they are unfortunately ill, the use of chronic disease management programs can help them to maintain or even improve their health conditions by that better adherence to medications, diet, and exercise regime. The fourth category is the triage and symptom checker. So if you're unwell or you have questions or you're unsure about your health conditions, you can go through the chatbot via Pulse by answering a few questions. And of course, that's helped through by the use of artificial intelligence. We can direct you to the appropriate course of actions instead for you to rush to a hospital or to see a doctor. There are recommendations. What else can you do based on the input of the data collected from various digital devices? And then the last and not the least is the telemedicine electronic prescription. And in the event if our Pulse users, they do require to see a doctor, we can also arrange the consultations with doctors either through video or physical visit. And then we can also arrange medication to be sent to your office or home address. So as a result of all these, our customers can have better access to affordable and personalized health services, and they are empowered with relevant health information and data via Pulse, as long as they have access to a smartphone and internet. Next slide, please. So Pulse is very unique, and every one of you can download Pulse. And then, of course, you need to change your app store to Hong Kong or to Singapore or to Malaysia or Indonesia. So the Pulse is very unique. It is the first of its kind in Asia. and it's AI-powered application. So we started the launch and the rollout of Pulse in Malaysia about 2 years ago. And now Pulse is live in App Store and Google Play in 11 Asian markets and 10 languages. So we did a lot of localizations in all the respective markets because we can't just simply translate everything from English into the local language. So the localization is more than just the translations. It also takes into account of the local epidemiology data. It also takes into account of the local healthcare custom. And then as a result, we would be able to give the right recommendation to the Pulse users in the respective market. So at the moment, we are working for more than 20 digital partners in the region. Some of them, they're local partners, some of them, they're regional partners, some of them, they're global partners. And as I said, you can download Pulse wherever you are, as long as you change your app store to the right market we operate. Most of the services we provide via Pulse, they are free of charge, including popular features like symptom check and health assessment in all the Asia markets. So please do try to download when you have time. Next slide, please. So since the launch of Pulse in 2019, there are about 21 million downloads, 24 million downloads so far in the 11 markets, which is quite impressive, given the fact that we only have 17 million customers in this region. And more than 1 million of them, the cumulative usage of symptom checker, health assessment, and traditional Chinese medicine. So you can see that these are the popular features used by the Pulse users. And we also launched quite a number of bite-sized protection products via Pulse, which include dengue fever, infectious disease, personal accident, COVID-19 coverage, hospital income, and some cancer products as well. So the millions of policies were sold directly via Pulse and our partners, and about 1 million new customers have been acquired so far through the digital channel. So Pulse is not only very important to our users as a health ecosystem, it's also very important to us as an organization because it generates a lot of leads for our agency. And again, a number of them been able to convert into offline sales by the respective agents and adding the APE to the company. So Pulse enable our users to have access to quality healthcare, no doubt about that, through the use of technology, but it also helps Prudential to broaden our customer base by getting new data, generate leads, and convert the leads into sales. And majority of the Pulse users, they're relatively young. They're between the 18 to 35 age bracket. And the average age of users is about 30 years old, which is about 10 years younger than our existing customer profile. And the most important thing is that 70% of them, they are new to Prudential. They are not our existing customers. So that would enable us to tap into the uncharted territory. And we firmly believe that Pulse by Prudential, the health ecosystem, will benefit the communities in Asia in the following ways. It improved further the awareness of health and well-being, especially during the outbreak of pandemic. And most of the health Pulse features, including the health assessment and symptom checker, they are provided free of charge to all the users in the region. Pulse users are empowered to take charge of their health through the 24/7 access to health information for better disease prevention and also treatment and better health outcomes. So all these will free up the valuable resources for our medical professionals to deal with critical health concerns and keep the medical costs at bay. So I think I conclude my presentation here, and thank you very much for listening to me. And I look forward to have more meaningful discussions with the other panelists and the attendees as well. Thank you.
So I want to thank all of our presenters. Fantastic presentation. We're going to now invite Gil Gil Bashe, who leads the global health practice for FIN Partners. If you're not familiar with FIN, something like 24 offices around the world, including Hong Kong, a total of about 850 staff, and a real industry leader for more than 4 decades, and a great friend of building bridges across regions and sectors. So Gil, the floor is yours.
Well, thank you very much. Let me get rid of that.
I do want to mention one other thing. Gil is not only sharing his expertise, he's doing this at roughly 4 o'clock in the morning, his time, while away from the office in a country setting in upstate New York. So special points for Gil Bashe.
Levy, that's very kind of you, but and very unnecessary. First of all, I want to thank our presenters so much for their sharing data. This was illuminating for me. I've been in the field for 40 years, and I hope that all of our participants who are joining us today have been as impressed as I've been. First of all, I really want to start by asking a very key question of Dr. Fung, Professor Fung, who kicked us off, and then I'm actually going to shift over to Andrew for a few moments. Let me start there. But Dr. Fung, you started off by sharing with us a very startling figure. I know that Bloomberg ranks Hong Kong as the world's most efficient health system. And you mentioned that Hong Kong dedicates about 6% of its income, of its GDP, to health specifically. And yet, as I think Dr. Yimien has shared, that you have your country as one of the highest life expectancies in the world. From your perspective as a globalist, as someone who's responsible for one of Hong Kong's largest hospital systems, a center of excellence, can you share with us a little bit your perspective of why Hong Kong is able to spend so little and yet produce so much in terms of quality of life and life expectancy?
I think there are a few points which are important. And the first point is still go back to the fundamental of public health. And I think in general, I think like life longevity and that sort of issue, it actually has a lot of relationship with basic public health issues, including, for example, diet, exercise, and everything. Now, I think Rupert, or one of the speakers, said that we don't do a lot of exercise in Hong Kong. Surely, you don't. I mean, although in recent years there are a lot of people taking up exercise, and in general, not exercise in the formal sense, but the we rely a lot of people rely on public transportation, like the MPR, and they do have to do a lot of walking, in Hong Kong. So Hong Kong is actually quite walkable, and people doing a lot of walking. I think there's been previous studies showing that the extent of people walking in the city is actually much more than in New York or in London, and so I think that's an attributed factor. And also, of course, diet is important as well. The Eastern diet actually, in general, it's actually, although Hong Kong people does consume a lot of meat, beef in particular, we are probably the second highest beef consumer in the world, but quite balanced in terms of vegetable food intake and that sort of thing. So you don't see a lot of obesity, in this part of the region.
Well, let me stick with what you have. Let me stick with what you have for a second. That's so important. I want to take your comments and jump over to Dr. Wong, Andrew, for a few moments along what you've just said. Andrew, you were talking about something I shared publicly. It picks up on what Professor Fung was talking about, which is this differentiator between sick care and well care. A lot of your presentation focused on the early engagement of the consumer. You also talked about life expectancy. From a payer perspective, how do you feel about, first of all, what Dr. Fung said? Is it diet? Is it more? I also heard, along with what Professor Fung was talking about, you and the other panelists are actively engaging the consumer as a partner in their well-being, in their health. Could you share with us your perspective?
Yes, thanks very much, Jill. So to engage our customers, that's very important to provide them more healthcare information, to educate them. And we firmly believe that prevention is better than cure. So one of the many reasons why Hong Kong people, they live slightly longer than some of the others, also because of the access to healthcare, because of the close proximity to hospitals, and it doesn't take long for the ambulance to respond to your request, and then they come to pick you up. Typically, it's also free of charge as well. So the access to some of the public healthcare can be quite immediate, and that saved the lives of quite a lot of us living in the city. But it doesn't really mean that we are necessarily too healthy. So a lot of us, we are quite stressful in living in this city. We always compete with time. We always worry about some other issues like financial, family issues. And that's why I think from Prudential perspective, we want to create the holistic health ecosystem to engage our customers and users so that they can change some of their lifestyle. They can sleep better. They know what sort of diet they're going to have, not only in Hong Kong, but also elsewhere in Asia as well. And we should also engage them to do a regular exercise in competition with the others. So if you go in the Pulse, you can find different communities having different activities, and then they can compete each other, they can join. And there are some leadership score board on that as well, so that they can find friends and compete against each other. So we try to create that sort of environment so that they become more health conscious, and prevention is better than cure.
Thank you for that, Andrew. And by the way, I'm always very conscious of our time. Pulse. So if people are looking for Pulse on their iPhones or smartphones, is it listed as Pulse? Is it there another name they should be looking for?
It's a good question, because we can't register just Pulse at the App Store or Google Play. So it's actually Pulse by Prudential. So you have to type these words to find that. And then you need to change your App Store to Hong Kong or Singapore, Malaysia, one of the markets we operate. And then you can download that free of charge.
Wonderful. Thank you for that. I'm sure some of our listeners will be looking for that as a best practice model. Let me jump over for a few seconds. And Yimian, I wanted to ask you about the whole concept of creating an individual Emma to engage people, and you're thinking about this. I wanted to ask you about the success of this, and all our panelists, really, you all, without seeing each other's presentation, all decided to deal with aspects of health technology, digital health. Yimian, can you share with us what the results of Emma has been? Do people really use it as a guide, as the next step chatbot?
Yeah, sure. Thank you, Jill. We launched Emma in Hong Kong, the first country, 2 years ago. So that was pre-COVID. And when we first started, Emma was mainly about services, although we started to introduce more partner services. So before it was core, like how to make a claim, how to find my doctor, how to check that my policy coverages, and so on. And also we converted over to a digital health card. So previously we had one of those, like credit cards that people show.
Yes.
And 2 years ago, we just said, okay, we go digital. And because of that, earlier on, we talk about coverages of insurance in Hong Kong. So about a third of Hong Kongers have private cover, and many are covered by their employers, so employee benefits. So we do see through access to outpatients, people are using their digital card and using the health service side of that. Since last year, because of COVID also, we accelerated our MR development to provide more services, for example, mental health, etc., and also teleconsultation, and that has improved engagement. Oh, and symptom checker, as Andrew said, we also have that as well. So we have initially provided that only to AXA customers. We didn't offer it like Prudential. We didn't offer it for free to everyone. However, in the middle of the pandemic, we then opened it to the population. So anyone can download, and then you can have a range of services like that are for free that they can use. So the uptake has been good. Where earlier on I mentioned about products where we give discounts for step counts, the uptake for registration and using it and tracking it has been 1 in 3 customers. So that is very good.
It's incredible. That's really incredible. Obviously something for the world to learn. The world has a lot to learn from Hong Kong, clearly from this conversation today. Let me jump over to Ximing, if you're available. I know you might be off camera, but you are with us, so I want to thank you for that. So you've brought in the whole aspect of digital health as well. And I'm just curious to get your perspective and also reflecting on our other panelists. Digital health seems to play a tremendous role in each of your efforts to engage people. And I'm going to say people, not patients, because we're people first and patients second, or when we're dealing with a health concern inside an institution, like what Professor Fung has built, which is extraordinary. Why is digital health, in your opinion, so important to your business planning to reach the consumer?
Well, I think digital health is currently, I think we engage digitally every day. And every single part of our life, we're speaking digitally right now. And so I speak as a millennial, I guess, but even though we are shifting into, a large population of elderly over 65, but we really need to target the people in the age brackets of the 20s and 30-year-olds, because, as Andrew alluded to, prevent and postpone, that bracket is so important to engage and to get people talking about, aware of their health when they're healthy, not when they're sick. And so, I mean, as a doctor, like, I wish so many times that when I've seen patients at the end stage of their disease, if 20 years ago they always say, if I'd known this 20 years ago, if I'd known this 15, 30 years ago at the beginning of my disease, if I had something that allowed me to check, to monitor, to remind, to inform me of what my illness is progressing or is becoming, then hopefully they can avoid the end outcome that can be quite disastrous. And so right now, if we want to get into people's pockets, into people's lives, into people's homes, and get them to think about health not when they're sick but when they're healthy, then digital is right now the most, I would say, accessible and also the most pervasive form of education and of, I would say, support, and also of activity and communication. And so what I really am passionate about really is reaching the millennials and the Gen Zs and the people that are coming through that may not want to think about illness, but they want to think about wellness and health. And so through all the different formats that you've seen today, I believe really will help hopefully create an environment and a group and a demographic of people that want to stay healthy and also in the long run have a greater impact on a macro scale towards the public health system, alleviating the pressures there, hopefully sustainability in terms of costs and inflation, and hopefully on a micro level, each person becoming healthier and happier and living longer lives.
Thank you for that. That's I think that your words apply certainly to the market that you're covering in Hong Kong, and you've covered many markets in your career. But I have to say that I hope that the rest of the world and people in both the payer and the provider, patient advocacy, product innovation, and policy levels have listened closely to your words today. Rupert, you've had an incredible career working with some of the greatest innovators in medical device innovation. And I was really struck by your presentation, by how thoughtful the health system is in Hong Kong in embracing health innovation, health technology. And I'm wondering, since you really have worked with companies around the world, if you wouldn't mind sharing with us your insights of why Hong Kong is particularly open-minded to making health technology available to its citizens through providers like Professor Fung and certainly payers like AXA and Prudential and Bupa. Why is the environment ripe and accepting of innovation?
Thank you, Gil. We can look at it in two perspectives. One is from the government side. I think the Hong Kong government is especially pushing Hong Kong, apart from a world financial center. It also like Hong Kong to be developed as also a technology hub for various technology, including medical device technology. I'm also sitting in the funding approval board of the Innovation and Technology Bureau of the government, and for the last couple of years, and I can tell it's actually the government is very generous to provide funding for many R&D as well as entrepreneurs and companies. They have a sound project to push on. So from the government side, I think they want Hong Kong to get the latest technology, especially also in health, in medicals. The other part is really from the industry side. As to be practical, we all want to do business. So I think Hong Kong have a very long history of providing medical equipment practices to mainland China for last 30 years. I'm actually selling Elsing, one of the older Israel imaging company devices to China in the 90s. At the time, Israel wasn't as a good friend country with China. We already start selling the latest technology product to China, which is a bigger market. So on the other hand, you look at it, we are not just selling Hong Kong being a channel of latest technology. Doesn't matter it's a digital health or telehealth or latest equipment. We have to do it first in Hong Kong. We have to make sure Hong Kong work before we bring it into China.
So if I understand you correctly, Rupert, you're saying that that Hong Kong not only is a best-in-class market, it is also, in many cases, a pilot market for companies to come in and access China. Is that correct?
Exactly. That's
beautiful. Let me go to our last question. This is one of these panels where I truly wish we had much more time to discuss this. Again, I want to reiterate how magnificent your presentations are. I want to extend our thanks to Levi Shapiro and the mHealth community, and of course, all of his connections in Hong Kong for enabling us to listen to your presentations today. Extraordinary. So that leads me to a question I'm going to ask Professor Fung first and go through. I'm really struck by how your health system and your ecosystem embraces technology, your universal focus on well care or self-care as opposed to sick care. And I'd love to know, because we only have a few moments left, in a sentence, what do you think the world's best takeaway can be from Hong Kong's success in spending, of watching it spend, and yet improving outcomes for its people? Professor Fung, what's your advice to the world? What can we learn from Hong Kong?
Well, that's a difficult question, but I think we got a very, in terms of our health system component, I think on the public side, where we got a very supportive government funding, and it's also a strong public sector that integrate everything together. That actually gave us a good foundation for everybody else to build on, like the private payer, private providers, everything. And because we got the public sector actually serve as a very strong foundation. And I think, for example, even I myself at the present moment in the private role, that foundation I think is important, for everyone else, to build on. I think that is a very unique and essential sort of component in our health system setup, I think.
Thank you, Professor. Thank you so much. And Sining, if you're available to join us for a few moments, what can the world learn from Hong Kong? Why is GDP at 6%? The United States, by the way, is at 18.7%, tipping soon to 18.8% GDP. And obviously our outcomes do not meet Hong Kong's. What's your advice to the world and certainly other developed nations?
I think I sort of echo what Professor Fung said. It's a very, I would say, very efficient public sector. I've worked in the public sector for quite some time as well, and it's no frills, but it's aimed at clinical excellence, and also really ensuring that everything that's done is done well, and it's done for the best care of its people. And now to say that it's a very dedicated workforce in the public sector, but also very, I would say, integrated care through public to private as well. And so I think it's really about that partnership and about that connectivity where public and private can work together to solve some of the big questions and the big problems with healthcare.
Thank you. Thank you so much. Rupert, you've been involved in opening doors and making innovation possible. Obviously, many of the people involved today are benefiting through the innovation that you've brought to Hong Kong and to China. What's your advice to the world from a globalist perspective? What can the world learn from the Hong Kong health system? Rupert, are you on mute?
Sorry.
That's all right. No, that's very usual in the Zoom world.
I think for simple thing is that it's openness and willingness. I think we, in general, actually, throughout years of interaction with other countries, we can see the medical profession community are very willing to share best practice, technology, innovations, and what they learn with each other. I think the main thing is to increase that interactions, to take away the border of countries, take away the boundary of countries and the boundary of people. That will be very.
Thank you. That's a key insight. Collaboration, loud and clear. I'm just I'm just going to jump over, and I'm just going to jump over to Andrew, who I know has to leave promptly. Andrew, your insight, you clearly have shared a tremendous amount. Looking forward to seeing your presentation yet again. What's your counsel to the world? What can the world learn from Hong Kong's health system? Andrew, are you on mute? It's very possible that Andrew had to leave us. So with that, I'm going to turn to you, Mien. I know that you are a protege of Professor Fung. I know that it was a delight for you to participate on this panel with your esteemed teacher. Could you share on the behalf of all of our panelists a final word on what matters most from Hong Kong? What can we learn from your experience at the rest of the world?
Thank you very much. I think there are 3 points here. The first is a great comprehensive public health system, which we already heard. So there is not just a safety net, but actually it sets the benchmark and the standards. So secondly, I would say is a good primary care system. So Hong Kong is small, but it's also very convenient. People can access healthcare cheaply and easily. So a good primary care system is essential. The third is actually the role of the government. The government haven't stood still. Professor Fung laid out the progress and the developments in health policy. For example, the voluntary health insurance scheme, the technology, the electronic health records, and so on. So the role of the government in coordinating some of these factors and bringing people together, all the different players, especially including the private sector who wants to play an important role and are critical, I think that it's very important that someone holding the ring, the conductor of the orchestra needs to make sure everything works. So I think those are the 3 for me. Thank you.
Wise words. Again, I want to thank our panelists. Fantastic presentations. They'll be available on the mIsrael site. They'll also be shared, I believe, on LinkedIn. I want to thank you again. I want to extend our collective thanks to Levi Shapiro and the mHealth community. Of course, our attendees, our participants today. And this recording will be shared with all, I'm sure, hundreds upon hundreds of people will learn from your combined wisdom. Thank you all so much.